El Rio Community Health Center is the 25th largest federally qualified health center in the nation. We reach close to 100,000 unique patients. About 34,000 of those are children. El Rio has been here since 1971 serving the community. We have 11 different campuses that provide medical care, dental care, healthcare services to all populations. We really represent our Tucson community in that we serve about 54% Hispanic Latino, about 22% of our patients are Anglo, and then about 6% African American, 6% Native American, and then a wide diversity of others as our community becomes more and more diverse. We also, I think what's interesting is that we take care of some of the most vulnerable people in this community. About 55% of our patients live at or below 100% of the federal poverty level. So that's just a little bit about our roots in the community and taking care of 1 in every 10 Tucsonans. For over 12 years, we have been an electronic health center. We've had electronic health records and dental records in place and have done a lot of work around capturing discrete data through our electronic health record because we're really a data-driven group, if you will. All of our patient populations are kind of monitored for gaps in care around primary and secondary prevention and where we can improve their health. So we really live by that data in helping to help our families and children. Particularly with children, for years we've been part of an immunization registry, and we see this as a great opportunity in cooperation with the Cactus Foundation to use the registry that they might develop around concussions and children's history around concussions and other injuries. We are frequently on the front line receiving calls from parents who are concerned and adults and that have had a head injury of some kind and are worried about concussion. And we realized, once again, from the beginning education we've had with the Cactus Foundation, that our knowledge about concussion is imprecise, and we need some continuing education there for all of our providers and our nurses to better assess and gather data from families and children. I think that because we, many times we're caring for newborn infants and caring for second and third generations of families, that continuity of care presents a unique opportunity for us to gather that data on our patients. And when we see them in periods of time, we hope to add to the body of knowledge about concussions in time and, just looking at some of the untoward outcomes related to physical health problems, cognitive problems, financial, socioeconomic, education issues that we might see with those children. And I think the other thing for our physicians, our pediatricians, was that this was a great opportunity with the Cactus Foundation to be able to embed a concussion clinic within our existing large pediatric practices, and that the tools for assessment were very easy to implement and cost-effective as we move forward. The other feature of being able to develop a registry, well, really 2 features. One is to give us that baseline testing on children, but also that this registry would follow children, wherever they receive care. If they were to show up in an emergency room through our statewide health information exchange, we'd be able to have that baseline data and any subsequent data to help in the care of that child. So from an organization, we're really interested in creating best practices around concussion assessment and ongoing treatment of children and adults. El Rio, as a community health center, we establish and work collaboratively with lots of partnerships across the community, whether it's with our community hospital, but also with many other organizations. One of our partnerships is with a community group, Emerge, that helps with domestic violence in our community. And many of those victims of domestic violence present for care here. So that's another population that we see as a vulnerable population, and we think this emerging science and data collection could help.